So, hi everyone. Thank you for tuning in. Today, we are going to discuss how speech therapy can be beneficial to those living with dementia and Alzheimer's. A lot of people don't always put the two and two together. We we just don't always think of speech therapy as being something that can be helpful for someone living with some type of dementia like Alzheimer's disease. But it can be a tremendous benefit in helping to slow down the progression of um, cognitive decline. And today we have a very special friend who joins us all the way from New Jersey, Miss Kathleen Scott. Thank you so much for joining us.
Thank you for having me.
Oh, it's such a pleasure.
Thank you everyone for coming. Thank you, Kina, for arranging this. I am so excited to be here today. I have been a longtime follower of Lisa's Care Connection, all the way from New Jersey, because as a caregiver, I've always thought about the fact that the caregivers care for their loved ones, which is so important, but who cares for the caregiver? At Lisa's Care Connection, I always, in any interaction, anything I do through that organization, I get the feeling you care about me. And that's so important on my journey, as I'm sure many of yours. So what happened, how this seminar came about was that, as Kina said, I'm from New Jersey. So there were so many times when I was like, I wish I lived near Lisa's Care Connection. And now because of the pandemic, I've been able to partake in a lot of the things. I've been able to partake in some of the support groups, which you all know are wonderful. I'm sure I'm preaching to the choir, journal club. And then there was a wonderful webinar. I'm forgetting the name of the person, but Kina hosted like a watch of that. It was a really powerful caregiver who had, she has an organization. And we watched it, and she mentioned in her webinar that, her mother had been declining a little bit in terms of her ability to find words and express herself during the pandemic. And she said, I never thought speech therapy would help, but it really did help. And that just got me thinking, as a speech pathologist for 27 years, oh my goodness, how many people are thinking it's not helping? So that's why we decided to do this, so that I could share with you all the things that I found helpful as a speech pathologist, but also just as a regular person. So
yes, and that's why I loved about the idea of Kathy joining us, because she mentioned in our conversations that I don't normally work with dementia patients, but my caregiving experience has allowed me to really learn more about it and incorporate the tools that they use into her personal caregiving experience. So I think that's probably the most meaningful thing right now is you guys want to know, what can we do with our loved ones at home and to benefit them and to help slow the progression, and especially during the pandemic, how can we add stimulation to their daily activities?
Right. Okay, thanks. All right, so Kina kind of touched on this. I just want you to know, I've worked in many settings as a speech language pathologist, but I've actually never worked in a skilled nursing facility, and I've never done home care. But I have several people in my family who've had the diagnosis of dementia. The one that really, where I was put in a position to learn the most was my mom. And she's been on her journey with dementia from at least the age of 79 that we know. And knock wood, she is 91 right now and currently in a skilled nursing facility, which has provided its challenges, as I'm sure many of you know, in terms of visitation and things like that. So I'll talk about that, but I just wanted you to know. So a lot of the things I'll suggest are not even necessarily, they may be things you're doing already, or things that you can easily implement. And I wanted to share some of those things with you so you understand the why and how they might help. Really, what has happened since I've been put on this journey is that I've been standing on the shoulders of giants. My colleagues who've worked more with this population have helped me over the years. Former students who are now working with people with dementia have helped me. the people in the facility where my mom is have really helped me, and then friends and family too, just in being support and letting me hash out different ideas. Um, so I am a speech language pathologist, but I work primarily with children with autism. I work some with stuttering, and I work with children who have difficulty with literacy, like reading and writing. So it seems pretty far removed from dementia, but over the years, I've noticed some parallels, and I want to share that with you. What I've done is just really harnessed out of the, necessity being the mother of invention. I've harnessed my skills as a researcher, because I do a lot of research and understanding what's in the research literature. So I've used those skills to look up what might benefit my mom. I've talked with my colleagues, but I've also use some of the skills that I've learned in working with some of my clients. Those with autism, many of you may know, their brains work differently than people without autism. And we all know in dementia, the brain is working very differently as well. So I'll talk about some of the parallels and how I've used them. Margaret is my mom. And then, I've had two family members who unfortunately have passed on, but have gone through the Alzheimer's and dementia journey. So I haven't been the primary caregiver for them, but I have been someone who's kind of helped troubleshoot different things in terms of communication in the family. So I'll talk about, all these experiences have kind of given me different tools that I hope will help you. This is my mom. This is pre-pandemic, right? Those were the days. And what I wanted to share with you today is why an SLP, which is a speech language pathologist, can often help even in the later stages. Some of you may realize that in dementia, early stage, people may have trouble finding words. And that is a key thing that we can work on. But even in the later stages, there are things we can do. Now, make no mistake, we're not curing someone. We're not reversing dementia. But there are ways that we can try to just keep those skills intact for as long as possible. And really, from my perspective, for me, it's all about quality of life for my mom. So the things that she can hold on to right now are conversation and eating. And so those are the two things that I'm really trying to do to maximize her quality of life. And those are two areas that speech language pathologists help with. So I want to talk to you about strategies that encourage communication. And then some of the things about behavior. I want to show you something that's in autism that goes right with dementia, in case you've not thought about it before, and how I've just recently started to learn about how that can affect eating in dementia. And then tell you a little bit about what I've learned about oral care. So a speech language pathologist, they work on speech. So they may work, you may think about it as them working with young children who maybe have a lisp or they can't pronounce, they might say wabbit for rabbit. And that's true, but there are people who have strokes and sometimes they can't produce their words as easily. And we work with that. We are certified to work with the populations from birth to death, basically. So sometimes they work in the neonatal care unit. Sometimes, we work in the schools, and then we work in the hospitals. But it used to just be known as speech therapy, but over, I don't know how many years, but it's been a very long time now, the language was added to our title because we really work on communication. And communication is how you get your words out, but it's also the language that you're using. And these are the skills that we think about as a speech language pathologist, the language component. We think about listening, which is understanding what people are saying, producing our own speech, right? Not just the speech, the actual sounds we say, but what's our words and our message. And then reading is a form of language, right? It's just words on paper. So understanding it. And if we are, maybe reading to children, to grandchildren, we're reading aloud, we're using our language skills to read and to write, right? So to understand letters that people write to us and to write letters ourselves. So we do work on all of those things. It's not just speech therapy. And what I did here for you is I took a document that I had made. I have found that, especially with a few family members of mine, where I've advocated that, this person probably could benefit from some speech therapy. And they've gone to the physician, and the physician has said, no, I'm not going to authorize that because, dementia is a progressive disease. And no, there's not really anything that can be done. And so I want you to know a few things. It was very frustrating for me as a speech language pathologist. Physicians do not get very much education about speech language pathology when they are in school. There's many things that they have to learn. So they don't really know the intricacies of what we can do and how we can help. And I think that they are thinking about it. Some of them, if they're saying no, like in my experience, it was because they're thinking, well, you're proposing that we can rehabilitate this person, like they had a car accident and we can get their skills back. I understand that, but they have dementia and that's a progressive disease. So they're kind of thinking about it in that way. I've even had nurses question, do you really think this is going to help? Help is a relative term, and I want you to understand that. And even if you can't get professional speech therapy, I'm going to talk to you about some things that you can do as well, or maybe you're already doing. So I wrote these next several slides for those physicians who were saying, no, speech therapy can't help, as an educational tool. And so I'm sharing it with you so that you have that background. If you feel so inclined and you want to share it with any physicians who may give you pushback, if you're lobbying for speech therapy for your loved one, feel free to use anything in this. So what I say is we are specialists in communication, but we also have specialized training in cognition, in thinking, right? And physicians understand that from the standpoint of someone who's had a car accident, but not always from the standpoint of dementia. But it's still all cognitive. We're experts in helping those who can't understand language. We work with young children who have trouble processing information. Same thing happens with dementia over time, right? They're not necessarily processing the information that's going in, or what you're saying is being processed differently by their brains. But we also work with, and this is key that I wanted to educate the physicians about, that we work with people who are losing language, losing speech and cognition. So we can work with people who have dementia, who have Parkinson's, who have ALS, even though they are degenerative diseases. And then I go into more, well, what are the ways that we can help? And I want them to know that speech language pathology isn't always about making someone better or, reversing their condition, but it's about helping people to understand and communicate to the best of their ability for their best quality of life, no matter how much time they have left. And so for some of you, you may get kind of a hard stop where your physician doesn't approve it, even if you advocate for it. For some of you, you may say, that's not the avenue I want to go, and that's fine. We'll talk about that. But do keep in mind that even end of life, you're not getting as many visits, but there are times when speech pathologists can be consultants for you, even on a short-term basis, to help with things like language and communication and eating. And a lot of times they're helping support you. So we train family and caregivers how to best communicate with people with dementia. So for example, I had to learn a little bit on my own as well, and I'll talk about that, but just giving wait time, right? And just making sure that we involve the person in the conversation that we're having, even if they don't understand everything. Sometimes it's really enough for the person to just feel involved. Even if they're not getting everything in that conversation, they feel like they're involved in the conversation. And that's truly important for quality of life and dignity. I remember that my mom used to watch early on, she used to watch The Big Bang Theory. I don't know if any of you have ever watched that, but it's a comedy program. And I would think to myself, how are you even processing this? Because there's a lot of banter and back and forth. Well, she wasn't fully processing it, but she loved it. And she would laugh and laugh. And she would say, I don't really get everything that they're saying, but it sure is funny. And I think that's important for us to understand. Communication, when they're feeling involved, even if they're not getting everything, is really important. And we help loved ones with setting up the environment so they can understand their surroundings. And you get support on this from other areas as well. But, speech therapists might help you set up a communication book or a memory book. Even if a person doesn't have the ability to speak or use words as much, we want them to be able to, maybe use simple pictures to be able to communicate their needs. And people aren't always aware that speech language pathologists do that. They will come in and see where your loved one is and help you to be able to set up like a communication board or something very simple. I did that once for one of my family members where it just involved 4 pictures and it had food, drink, bathroom, and help. And he understood enough that he could point to these and communicate even though he couldn't use words. But I will tell you, when he was in the hospital, no one came in to support this or to do this. So if you get a speech language pathologist on board, they can help with you setting up ways that they can communicate. And a lot of you probably look through photo albums and memory books, but also like structuring memory books for family relationships and things. Those are great things. I have a couple books from my mom from earlier on where it's some of her early years and pictures, and there's just simple words under them. And we used to go through them together and she would read them. So these are other ways that speech language pathologists can help. The other thing is that I teach college students, and the thing that I'm always training them on is that all behavior is communication. So all behavior represents an unmet need. And if we look at everything through communication, you can see why speech pathology may be involved. And I think if we are able to help patients communicate their choices and their opinions, and be participants in conversation, even if it's not a full participant, we really are preserving their dignity. And there's ways that speech pathologists, we can find that, even if you think that, oh, there's not really much that can be done. We'll find the things that can be. So this is what I put at the end for physicians to know. Like all medical professions, speech language pathologists follow a code of ethics. We understand our scope of practice, and we don't treat patients if we feel like there's nothing we can do. So as I'm saying, if you're getting toward end of life, they may only be doing a few things just to kind of help you manage at the end of life. Maybe help your loved one be able to communicate if they can't do it verbally, or give you some strategies for helping them with eating. But this isn't something always that goes on. And I think sometimes people worry that, oh, people have the wrong intentions, but speech pathologists know, we'll tell you what we can do and what we can't do. But a lot of times people don't necessarily know that scope. They think that there's nothing we can do, but instead of focusing on, getting better, we focus on things that are functional. So instead of focusing on, oh, can you, name the opposite of cold, which we might do with somebody who's recovering from a brain injury, we'll do more things that are functional. I remember a woman who was working on things like remembering the day and the date and the year. And although that's important, She had end-stage dementia, and it would only frustrate her that she couldn't remember, and she was living with her daughter. So she really didn't, it wasn't that important. But what was important was communication. So things that we did that helped were she loved Elvis. So her therapist worked with her, would play some of the Elvis music, and that would get her starting, being more participatory in conversation. And that's what we want, is we want to tap into how do we get the conversation going. I think a lot of you may have heard about music and memory, and music being one of the last things to go in dementia. So if the patient has a musical interest, we can harness that to perhaps get them talking. And so what the therapist did was she used the Elvis to get the patient going, and then started talking. And normally, if somebody were in a rehabilitative setting, like they had a brain injury, then we might ask them to name items in a category, because that helps organize your thoughts so you can retrieve words. You know how sometimes you'll say, oh, it's on the tip of my tongue, I can't think of it. My mom can't retrieve my name anymore. But if I'll say to her, it starts with a K, she'll always say Kathy. So she can retrieve it, but she can't just retrieve it right away. So we would work on things like, name items in a category with people who are recovering from a brain injury. But in dementia, we might want to do it in a way that's more conversational. So what this therapist did with her patient is she knew that the patient liked flowers. So she brought in different flowers to the session, and she was wearing a flower shirt, and they looked through a calendar with flowers, and she asked, like, what's your favorite kind of flower? What's another type of flower that you like? What's another type of flower that you grow? It's the same questions that you might ask in like a brain injury rehabilitation setting, but it's not, it's very much more functional. You're having a nice conversation about flowers. So using themes like that, if you think about trying to think of things in a category, but make it conversational. If you think about just trying to get your loved one to have a back and forth exchange, that's really what's important. And what I had to learn, which many of you may already know, is you get to a point where you just have to go with it in conversation. Early on, I used to try to correct my mom. No, mom, you didn't ride your bike here. You don't even have a bike. But now we're to the point where I realize, and I've been taught by people, that I have to just go with it. And what I have found is that when I just go with it, she talks more and more and more. And we may say, well, none of that's true, but it's her reality. So does it really matter? Because having a conversation, the more you continue to have a conversation, the more that preserves the ability for you to have a conversation. You're not necessarily going to get better, but it may stave off some decline. And even if it doesn't, because we don't necessarily have evidence of that yet, what it does do is helps them enjoy the time that they have left. So my mom will say, now throughout the pandemic, I've had to do Skype calls with her instead of, seeing her in person. And the facility has been wonderful to allow us to do that. But, I'll ask her, did you go outside today? It's a beautiful day. And she'll say, yes, I did. We had to wait a long time for the bus. So she's in a facility, and ever since she got there, which this will be she will be there 7 years this year. She has termed the activities room school, because in her reality, that's what it feels like, school. She would be in the activities room all day. And then, they'd have dinner later on. And usually about 3:00, she'd be looking to go home from school. So she'd be trying to wheel herself out of the activities room. And you could see why someone could perceive it in that way because, they had activities coordinators who to her were like teachers. And so there was a lot of that. And that was her reality. And I needed to go with it. And that really was a good way to embrace it. So she'll say now when we're on a Skype call, yeah, there were a lot of people on the bus today, the bus was late, things like that. And I'll say, oh, was it really crowded? No, not too crowded. Okay. And so what did you guys do in school? Did you do your exercises? Because they have a move and groove group and she hates it. Yeah, we did that sometimes. And then I might ask her something else. And really, I'm just going with whatever she says, and that keeps the conversation going. And you may already do this with your loved one, but I just want you to understand how important it is, how wonderful that is. And it doesn't matter that any of it is true, right? They're in a safe place. They're not going to come to any harm. I used to be afraid when my mom lived alone and she would say, I'm going to go around the corner to my father's store, because then I thought if she really lives in that reality, she'll go and she'll walk. But now I know she's in a safe place. We can have these conversations, and it really just is about the act of having a conversation. And that really helps keep their language as intact as possible and keep them to have quality of life as much as possible. You know, a lot of times people think there's no quality of life. I'm sure many of you have found these golden nuggets. It's been a journey for me. I had to find the golden nuggets and shift my perspective. For example, I've gone from being my mother's daughter to her sister, to her cousin, to her neighbor, and now I'm just a good friend. And in the beginning, it was really hard for me to make that shift that I'm no longer her daughter. But I did learn to embrace it. And I remember specifically the day I really started to embrace it when my mom said, nobody comes to visit me. My family never comes to see me. So I took the opportunity to say, oh, that family of yours, I don't know about them. Man, why don't they come to visit you? Look at me, I'm here. So I had to kind of shift my perspective. And I think there are so many things now that with my mom, you expect, there can be one moment where you feel like she is not processing a blessed thing you are saying, and she just is so out of it. And then it's a couple moments later where she's putting these things together and she's coming out with these witty remarks and all kinds of advice that she has for people. So I think we don't know enough about dementia to know when are the circuits going to fire or when not, but there's lots of those good moments we can still preserve and appreciate while we have them. I think that one thing, if you are advocating with a physician, you want to be very clear, physician, nurse, whoever it is, that you are advocating not to reverse things. You just want some things maybe to help maintain where they are, and or just to help manage their communication. When we've had, physicians give us denial, I really have felt like it's been because they think we are in denial. And I've had someone actually tell me that once, you're in denial of this, you have to accept that your mom has this condition. And I will always say, I do accept it. I absolutely accept it. And I know this isn't going to reverse it. I just want it to help with some of the skills now. And so that's something that you want to advocate for, that you're not in denial. You're not looking for a miracle cure. You want the physician to know that. You're not looking for a miracle cure. You're just looking to try to help with communication in ways that are possible for now. And also that full well it's going to progress. So I've kind of come to saying that to professionals over and over, that I know we're going to progress. I know things aren't getting better, just because then they start to realize that you're not asking for things that are unrealistic. We talked about just kind of when you validate their reality, it just leads to a productive conversation. Other things that I have done, and many of you may be doing these already. And again, I just want to validate that they really are a form of working on and facilitating communication. So I've taken games that my mom has enjoyed and adapted them. So if you want to think about it, this is how I had to think about it, because remember, my background is more working with the little ones, with things like learning to read. How sometimes if you're playing a game with a little one, they don't follow all the rules. And you just adapt to it and you just go with it. Because at the end of the day, what's it really about? It's about enjoying the interaction. And one part of communication that I actually didn't talk about, or that what a speech pathologist works with that I didn't talk about, is something called pragmatic language. And that's the ability to communicate socially. So that's a huge area that we treat. That's why we treat children with autism and being able to communicate socially. So if you think about that in dementia as well, it's about the experience. It's not always about following or understanding all the rules. So we've played Rummy Cube with my mom and we've just adapted to whatever she can do. And, she doesn't always understand the entire experience of what she's doing, but we've helped her along the way. And she's just enjoyed the interaction. And sometimes we rig it so that she wins. Now, I don't know how you all feel about that, but some people will do that with a 3-year-old, right? You rig it so that they win and they're happy that they won. And boy, my mom is just like that too. And do I care at the end of the day? No, I want her to have a good interaction. I don't know if any of you have played the game War with cards, and it's just a simple card game where, each player puts out a card, flips over a card, and then whoever has the highest card wins. So if you think about that, I've done modifications of that game with my mom. Maybe she, my husband, and I will play, or she and my husband will just play because they like to be competitive with each other, and they'll hold up their cards. You can do this on Skype if you're not in person. You can do it in person if you are. And I'll just say, oh, whose is higher? And she'll have to look for higher or lower. And higher or lower, those are all language concepts, understanding them. So we're trying to kind of preserve that language concept. We've played blackjack or 21, and that's working on the cognitive skill of working memory, having to hold something in your mind long enough to be able to work with it. So I'll say, okay, mom, you have a 2. You have a 2 and a 3. What is that? And she can still harness her addition skills. So she'll say 2 and 3 is 5. And then I'll say, okay, do you want another card? Help her to flip another card, or I'll deal her a card if I'm the dealer. And I'll say, okay, now you have 10 more, add 10 to that. So I didn't tell her 5 plus 10. She had to hold the 5 in her mind. And some days she could do it really well, and some days she couldn't. But it was something, again, that we were working on that cognitive skill. Like 2 and 3 is 5, she would say. I'd say, okay, add 10 to that, 15. So that's working on her working memory. She also grew up playing a game called Sevens. I don't know if any of you have played that, but you can Google any of these. I'm sure you could get the rules. And she, with this, the first card you put down is a number 7. And then people have to put the numbers below it, like 6, 5, 4, 3, 2, 1 in the same suit, kind of like solitaire, or going up 8, 9, 10, right? And so we've modified that game as well. But really, any game that they like, that they enjoy, just don't worry about that they can't understand all the rules. Just adapt it and make it as simple as they need for them to be able to play. And then I talked about like the conversations. Early on, my mom could drive and initiate more of the conversations, and she still has days where she's pretty chatty and she'll initiate lots and lots and lots of questions. Same ones over and over, and I answer them over and over because it's about the experience and the going back and forth and having a social conversation. But I've had to learn also to give her more wait time. I've had to learn to go with whatever topics she wants to go with. And that, again, is really helping with conversation. And that's helping in conversation. You're helping them to process information. And I really do feel, this is my personal opinion, that, like in my experience with my mom, it's use it or lose it. So again, I have no unrealistic expectations. I've seen the decline. I know things are getting worse over time. But I do feel like the more we can keep things going, then if nothing else, the better quality of life she's having right now. And it helps her try to be able to retrieve words and think of words and keep words in her vocabulary. So those things over and over and over, they're hard to listen to and answer. But when you do that, I think that also helps some of the vocabulary to stick. We have routines, and every time I see her, I say, "Do you know who I am?" And she'll say, "No, I don't know who you are." And I'll say, "My name starts with a K," and she'll say, "Kathy." And because we always do that routine, I think that kind of helps it stick. I won't get into all the specifics of this, and this isn't a plug for blood thinners or not, but this is an article that you can look up that talked about my mom's journey and how I had to adapt some of my interaction with her to help her to communicate better. And it's based on another article that you might find helpful about blood thinners and dementia. It's not anything like saying blood thinners cause dementia or anything controversial like that. But in this article, which you can get at today's Geriatric Medicine, a student kind of did an analysis of video of my mom and I, and how I didn't, even as a speech pathologist, give her enough wait time. And that it was because the less she was talking, the more I was trying to talk for her. But when I learned to hold back, she talked a little more. So that's kind of the takeaway. If you want any of that background, it'll be in the article. Now, if you think about kids and how kids have to do summer reading, I used to go visit my mom, and we would sit outside, and I would find books that she might help us to start a conversation. Her father owned a store growing up, and she and I used to watch Little House on the Prairie. So I tried to find the Little House on the Prairie books to read to her, because she couldn't necessarily read everything there. But they were too hard. So then I found that there were lower versions of the Little House on the Prairie. And there was one about, if any of you remember, the Little House on the Prairie with the Olsen store. And it featured a lot of Nellie Olsen versus Laura Ingalls, but a lot of things that went on in the store. So my mom could relate to that. And that really helped a lot. It helped with, we would sit and we would read, and here's how I would adapt the reading. And you do this for young children too. There's something called shared reading that you do with young children, where you don't worry if you read every word on the page. You don't worry if they pay attention to everything. You can modify and adjust the language to a level that they can understand. So the first summer I was reading the book, I would adjust the language a little bit, but the next summer I had to adjust even more. And I might just kind of tell her the gist, like Nellie was talking about this and Laura was talking about that. And then I'll read a little from the story, but I'll just adjust it to a level that she can understand. And you can do that because you'll watch their signals. If they're still with you, then they're understanding it. If they're not, then maybe it needs to be simpler. And at this stage, I haven't really been able to find a story like that engages my mom. She's more engaged in conversation, but you may find that this is something that sparks a conversation. So we may read a page in that book back then about Laura and Nellie, and then I'll ask her about her father's store. And she may reminisce about some things about her father's store. And she thinks it's happening now, but again, it's all sparking that conversation. So those are really good language skills, understanding of language if they're listening to parts of a story. And just remembering that they don't have to understand it all, and you don't have to read it word for word. This was another thing that I did. If you're working with people at home, then you might have a different system. But because my mom was in a facility and I couldn't always get there every day, I would send letters every day. And so I'd have this stack of letters that the activities department who was so wonderful knew to be like, oh, Margaret, you got this letter from your daughter today. Look, it says Monday. And she'd open it up and there would be a letter like this. And that's working on her orientation, of course. But they would have her read it. So it's working on her reading, producing the words. It's working on her understanding the words. And it's working on vocabulary, like things she may have forgotten. We used to watch the Kentucky Derby all the time with my dad. So I made that a new event that we do together. And when the Kentucky Derby was coming up, then, I would print out for her, okay, here's the horse names. Who are we going to pick? Who's going to be your bet? And that, again, is like looking at the words and being able to choose something. It's all a social conversation, right? That's what we all do with our friends. We're going to the Derby or we're watching the Derby and we're talking about our picks. So I built it around that. And then you'll see this is a little bit less, but what happened over time is that I had to make those letters less and less complicated, because when activities would always help me to know that, like, okay, she really isn't understanding the letters or they're confusing her. And eventually we had to phase them out because I was no longer her daughter. It was confusing for her. So we had to phase them out, but we used them over a number of years and I changed them to different forms that she could understand. And here's her with that Little House on the Prairie book that we read together. So, things like reading, everything, if you think about it like it's a social conversation in any way that you can simplify things so that they can participate in that social conversation, I think that's most important for their wellness, their dignity, and trying to preserve language as long as possible. Then the other thing that I wanted to share with you is something that I learned from working with children with autism. And there are many children with autism who can't communicate. They're nonverbal. So it's very frustrating. They can't communicate what's going on with them. So they may have behaviors that come about. And so what we learn is that we try to analyze the behavior and figure out what is the unmet need. Do they need attention? Do they need something tangible like a food or a drink? Do they need to escape something like they're in pain or they need to go to the bathroom? Or do they have a sensory need like maybe it's too bright in the room or too dark, or they've tasted something that just tastes really bad to them, but they can't communicate it. And if you think about that in dementia, it's the same thing where you see these behaviors, you don't understand where they're coming from. And the patient, even though they may have verbal skills, they lose that ability to communicate it in the same way that you and I would. In my mom's facility right now, there's a client who can speak full sentences, but when she needs to solve a problem, the only thing she knows how to do is to yell help. And it does get her communication across. And sometimes I think people see that as, oh, they're just trying to, I don't know, manipulate, it gets frustrating. But really, what it is, if you think about it, is that they don't know how to problem solve anymore, right? That cognitive skill goes away. So even if they have the communication, they don't know how to use it. And that's very common in autism. Lots of children with autism know lots of words, but they don't know how to use them to get help. Like there's a story of a young man who really, not a very young man, he was about 7, who wanted something that was on a high shelf. And his teacher said, if you want it, ask me for help. And so she told him what to do, but he didn't do it. And then later she found out that he was writing the word help in another part of the room. Well, what he didn't understand is I have to show this word to that person for them to know. And so it's the idea that, your loved one is trying to communicate something, but they don't have the words or the problem solving skills to do it. So if you ever can't figure a behavior out, you always try to study what happens right before the behavior and then what happens afterwards. So one of the things that used to happen in my mom's facility that would boggle their minds is that at 3 o'clock every day, I said she's trying to wheel out of the activities room. Now she's supposed to stay there through dinner, but in her mind, it's the end of school and she's going home. So what would happen is she would become extremely agitated and confused. And she would, I would usually try to come around 3:30 and I'd get there and she could be in the middle of just being very agitated and all of a sudden be fine. And everyone would say, well, what was that? What is she doing? How can she be fine now? And one of the aides actually said that I don't understand this. And I had to really think about it, but I put it together and I said, I really think about her as like a 2-year-old now. 2-year-old is lost in the mall because come 3 o'clock, that's no longer a schoolroom to my mom. She's verbalized. It's the mall, it's the movies. She doesn't understand her surroundings anymore. There's like the sundowning. So she's in this place where she knows no one. Even if you were her teacher a half hour ago, now you're not her teacher, you're a stranger. So she's like a lost child in the mall, screaming and crying and carrying on because she can't, find her mother. And then I walk in and she goes, oh, there's someone I know. Now she can't verbalize all this, but that seems to me to be what's happening. And so thinking about those things as all behavior is communication has really helped to try to understand things that are going on. So if that may help you with understanding some of the behaviors, studying your loved ones, or help others who are having trouble managing their behaviors, I hope that helps. And you may know this, more physicians know this than understand about the language part. But you may know that speech language pathologists also help with feeding and swallowing. Again, this is not my area in that I don't work in these facilities and do swallowing. There are many areas of specialty in speech pathology, but I've had to learn things to help my mom. And within the last month or so, she's been losing weight and not eating, and she was the clean your plate person. And so they asked if I could come in now, taking all precautions and come in and try to help with feeding. And I really was having the same troubles they were, that she wasn't opening her mouth. And I was fortunate enough to have another colleague who has worked with this population, and she zoomed in with me and she watched and she said, look, watch. So my mom would have her mouth open a lot in the beginning of the meal. But then, toward the middle, it would be less. And she'd say, you got to vary that taste because that's too much for your mom. You've been eating how many bites of tuna fish? Nope, she's done with that. And think about, we all have the choice, like, okay, we'll take a bite of tuna, then we do this. But when someone's feeding you, are you getting that choice? So she said, why don't you try the ice cream that she loves so much? And then there you go. She opens her mouth more. Or right now that flavor's not connecting with her. So try something else. Or right there, she really wasn't quite done. She was clearing some things from her mouth. And so my colleague really helped me to understand that once again, all the behavior was communicating something. And that has helped me to be able to help her with feeding. So that's something that speech pathologists can help with. That I think you'll get less resistance from physicians, and even sometimes at end of life. Again, you may just get a couple sessions, but speech pathologists can help you understand things better. That 1 hour with my colleague really helped me understand better about feeding my mom. So, and this is another article that you can access. It's from our national organization. But it's the idea that many years ago, we used to think that people who needed to be on special diets, like some people with dementia are, because of swallowing difficulties, that if they were on the wrong diet, that was the key reason that they got an aspiration pneumonia. But now we know that it's not always just that. A lot of it might be the oral care. So a lot of you probably know how frustrating oral care is. to manage in dementia. And I've lived this with my mom. She's got not enough dentition to chew really well, but she doesn't have dentures, and she has places where food gets caught. There's all kinds of stuff going on in her mouth. And you think about that, how if you really can't clean someone's mouth well, how much bacteria builds up. Well, that's one of the things that the research is showing, is that one of the ways to prevent pneumonia is to try to prevent the bacteria, to have the best oral care possible, because it might be the bacteria that they're aspirating causing the pneumonia. So this article tells more about that. But I was having a really hard time, because even though the facility manages my mom's oral care, I would try on the 4 days a week that I was there, I would try to help out and do that as well. I would try to help with brushing her teeth and things. And we went through various phases of that. But it took a very long time for her to kind of trust to have me in her mouth. But then I learned many things along the way. She was very sensitive to the toothpaste, didn't like the taste, it was too strong. She might, start to kind of choke on it. It's hard to have somebody else, inside your mouth all the time. And again, not being able to communicate with words like you and I could give specifics. So one of the things that, this is not a plug, I get no kickbacks from this. Lisa's connection doesn't get any kickbacks from this. But I had a dental hygienist friend who said, why don't you try this? It's called, I'm terrible at holding this up to the camera. It's called Closis. And it's a non-irritating rinse. And she told me that it has no flavor. And I've used it myself, so I could kind of see absolutely no flavoring in it whatsoever. And she said, if you're trying to do oral care, just take like a gauze pad and put it on there and kind of wipe it like you would a washcloth in your mom's mouth. And that will help. Like I used to wipe her gums and her teeth, and I'm doing a little of that now too. But I obviously wasn't during the pandemic. And that helps kind of manage the oral care when you can't get in there and brush all the time. So I've been doing that, and she's been very tolerant of that because it has no taste. It doesn't have anything that will bother her. And then my dental hygienist friend, I also said, well, I can't get over here because her teeth are here and her lips like this. And she said, just tell her, I'm going to pull your lip down here so that I can get in here. Just tell her everything you're doing along the way. And I had to learn that, but that's really been a blessing. And I was fortunate enough to really lobby for that oral care to stay during COVID. So what happened is I provide the Closis, I buy it for the facility, and then they do it after every meal. They use that in addition to brushing her teeth. So that's really helped, I guess, kind of preserve and prevent pneumonia as much as possible. So those are some of the tips I wanted to share with you. And I just want to say, no matter where you are, you're at the beginning, the end, many of you have cared for several people in your lives. Just get the support you need. And, if you think something is right for your loved one, don't be afraid to fight. I've had to learn that. Hang in there and enjoy the good times. Thank you for, wanting to help your loved one. And I want you to know they're so lucky to have you. And my mom used to say, when she more thought I was her sister, she would say to the facility social worker, if you ever have a sister, get one just like her. She would say that about me. So that's what I want you to think about, that your loved one, even if they can't verbalize it, and even in those awful moments, they still know that you're really doing a lot for them. So Keena, I'm sorry, might have been a little long.
No, it was so worth it. Thank you so much for taking the time. I feel like we got so much out of your presentation that we would have gotten from any other speech therapist, because you do have so much of your own experience to add into it. There was so much I would like to continue to talk about. And I know a couple of you joined late. That's probably because the Zoom link reminder I realized did not go out, and I apologize. So I'll make sure you get the presentation in its entirety. I will allow you to unmute yourself if you'd like and ask questions. there's some things that really stuck out to me beginning, back in the beginning of the presentation, Kathy, when you were talking about the visual cues and how helpful, visual cues, which we talk about a lot, can be helpful in giving people an additional way of understanding where the bathroom is or this and that when words no longer have the same meaning or connection to them. And we also suggest using those visual cues as a way to give them options. Because if you ask, would you like this or that, sometimes they're just not able to make that verbal connection and to answer. And so we just give up and make the decisions for them. Sometimes just holding up different visual signs or words or pictures can allow them that choice, which you mentioned a few times, having that choice and how important that was. So I love that. I was just taking notes the whole time, really. I love the tips that you gave for communicating with your doctor if you're trying to get speech therapy for your loved one. As you mentioned, doctors don't always have specialized training in different areas that we're interested in, like dementia. It's hard to believe that general practitioners aren't required to have, dementia training, but that is the case. So you gave a lot of great tips in your conversations that you might have with your doctor if you're trying to get some speech therapy. I love how you said start with, I understand this isn't going to make the dementia better. I understand that this person is not going to get better cognitively, but I would like to better help maintain where they are now. That was a great tip. Or you also said later that you could kind of take the direction and how the speech therapist can help you as a caregiver. And I need more help in understanding how to feed my loved one. So I thought those were really great tips that I hope stood out in your mind as well. Adapting games, that was really fun. I love the idea of letting go of the rules and expectations. I think you're perfect for this conversation, Kathy, because of your work with kids. And I think as adults, we get stuck into being right and our need to be in control and to be right and follow the rules. But you brought that extra perspective that no, you don't. We don't have to be right. That's not what it's about. It's about connecting and having fun and joy and stimulating their brain while you're at it. So I love that tip. There was one little nugget you slid in that I really loved. And when you talked about the power of holding back, and I think we're all guilty of that. We hate moments of silence, right? We don't like to hear any dead moments. I mean, think of how, listen to me, I'm talking so fast right now trying to get through this, but that's so true. Like sometimes we just need to take a breath and just sit with things for a moment and see what comes out. We try to rush things so much. So I love the power of holding back and waiting to see what comes out next. So those were some of my takeaways. And I wonder if anyone who has joined has any thoughts or questions that you got from this.
Tina?
Yes, ma'am.
It's Elena. One, I wanted to tell Kathleen, I so connected. I didn't get to hear all of it, and I'm going to listen to the recording. But when I came back on, you were talking about how your mom thought you were her sister. My mother insisted that she never had children, and and that I was the nice lady who took care of her until she had surgery, and they were concerned that anesthesia would make her dementia worse. She came out of the surgery fighting the nurses and telling them that her daughter was going to come get them. And for about 2 to 3 weeks, she knew I was her daughter. And then she went back to me being the nice lady. But I really resonated with you there. But two other things. One, when my dad had his stroke, the speech therapist was able to help. The dietitian got us connected with pureed food. And we were able to share that with the speech therapist they had, because they did not know that you could buy it. And it was really a blessing. And so we shared that with the therapist, who passed it on to the department. And then the other thing was, and I put it in the chat when you were talking about the oral care, they got us connected with some swabs. I forget what they call them, and I'm sure different brands, but it looks like a tiny sponge on a giant Q-tip. And that was really good. But I wish we had known of the product that you had that we could have put on there, because we struggled. We just used water, but that would have been really good. But those swabs really made such a big difference. It wasn't trying to get your finger in there.
Yeah, they're called toothets, and my mom's aide always says, I use them because I don't want her to be mad and bite me.
Yes. So, but anyway, but I thank you for what I did get to hear, and I'm going to be waiting for Keena to send me the link so I can hear all of it.
Awesome, thank you.
Yes.
Absolutely. Yeah, a lot of our caregivers, even though they may not think about home health and speech therapy, they have a lot of home care, that you have someone coming in the home as a companion for your loved one in some way. And so a lot of the tips that Kathy shared are things that you can share with your home care.
That's a great idea. Yeah.
So they can carry on this activity, because it's great when they can, you do so much as it is as a caregiver. If you can have someone else kind of participate in these activities, and they want ideas of things to do. So I know several of you have home care aides. I think these would be great ideas for them. Any other thoughts or questions or feedback before we wrap up?
I know I will say with, I had access to a lot of college students. It may be a little different during COVID, but maybe in the future it's going to open up a little more. So I had college students who also love to, come in and sit with my mom, and I train them in this way too. So maybe that's a resource for you as well.
Yes, yes. We work closely with our local university here in South Carolina. And we have a respite care program. Obviously it's closed during the pandemic, but we hope to get it reopened soon. And a lot of the activities you mentioned are things that we might do during those hours that you leave your loved one with us. So I love that you gave us some ideas, but it also helps me realize that we should be sharing the things that we do at that program with our caregivers so that they can do it at home. And so it's not just those 4 hours a week that your loved one is getting this engagement, but you're able to incorporate it into your daily lives. And you really nailed it in the beginning when you started off talking about really meeting them where they are. I mean, we say that so much to dementia caregivers, and I know we really drill that in their heads, but it's so important to keep reminding ourselves of that. And you did a great job talking about, with conversation, just kind of going where the conversation goes. And really, I like the idea of challenge yourself. How far can you take this crazy story? Just how far can you take it? How far can you keep them talking about whatever they're talking about? Even though it's not true, it could be totally outlandish. So what? How fun is that? That's bringing joy not only to your loved one, but before you know it, you're smiling and having fun too. And our caregivers always want to know, how can we bring more joy into our caregiving situations? And that's a great way to do it, so I appreciated that part. So thank you.
Keena,
Yes,
there was an activity that we learned at Lisa's here in California. The young lady who did her class had people interviewing each other. People with dementia who could not remember who they were able to stand up and share maybe the answers to 4 or 5 questions of the other person that they interviewed.
Cool.
And that one was so awesome. And so one of the things, though, that we didn't think of doing is when my mom was still with us, was to ask them about the old days. My mother died at 102 and a half.
Wow.
So she was born in 1915. And she lived through all of these times. And we didn't ask enough questions until one night a waiter in a restaurant said, "Oh my gosh, you guys must have had so much history." And even though they don't remember a lot of the things now, they could share some of those activities. I mean, those
Yes.
those times that they lived through, because that's that long term that they do remember that. And so we did with my dad. My boys were able to interview him and recorded him about his experiences during being a soldier in the World War II in Korea.
Right.
And that's something else that you can sometimes with the loved ones
Yeah.
do, and they get chatty, and we ask, like, well, when you were 5 years old, didn't you do that?
Mhm.
And or what did your sister do beating you up when you were little? Little things about family that really can trigger those old memories.
That's right.
Yes.
And Kathy, you mentioned music. We're always talking about the power of music,
Yeah.
right? And Bill's joining us now. I know he uses music a lot with his wife. So I really got a lot out of you talking about how music can boost our conversation. There's this gentleman that we've seen the video of a lot, who was a big jazz buff back in the day.
Yeah.
I know, I can't block it on his name, but you probably maybe seen it. But he's pretty much mute most of the time.
Right.
But when you play Cab Calloway, he lights up, and he not only can sing the music, but he starts talking like you would never imagine he's mute. So that's also a good reminder that music's not just something to help their mood or help calm them down or energize them, but it's also a way to get them talking, and talking and communicating. That's your cognition. So that's a great reminder. Bill, I see your hand. Oh, go ahead.
I was just going to say, I discovered this similar thing to Elena, where we didn't have a lot of history on my mom and talked about things. She lived through World War II. So now we sing all these World War II songs because there's a woman named Vera Lynn, who's like in her hundreds herself, who was like, used to sing all kinds of songs in England. And that's where my mom's from. So we sing the songs and then we talk about her experiences. So it all kind of connects together.
So neat how you can learn so much during that.
Yeah.
Who would have thought? Bill, do you have a question or comment?
Yes, it has to do with trying to get instructions to them, or if it's not that, then it's what you're doing to help them step by step. And you have to keep it, I think, you have to say it pretty simply.
Yeah.
And I'm not sure all the time that I've got that down, because it's just hard to go from normal life to know how slow is, or how the steps are more than one, even though you're trying to do it on a one basis. And I don't know is it just a practice, try to keep trying to understand myself when I'm doing it, if she doesn't seem to grasp it. I guess that was something I wanted to ask. And then the other thing, Kina, you're recording this?
Yes.
Okay, I want to see the first half. I couldn't make the first half, but the second half was really good. And you brought up some subjects about some simple games and simple reading books. Those are two things I wouldn't even have thought about. So I'm going to try some of those things and not worry about the rules. That was really good guidance as far as trying to get them to play cards. And, your first thought is, well, you can't do that or whatever. So just so it works any way that they feel it's fun. I think that would be one way of putting it. Kina, you might be interested in, I've got a new person coming in to help Betty. Started Monday. She is the first I've ever had that has accomplished 3 days. She had her up dancing. She was talking and telling her stories about her mother. This lady is unbelievable. I didn't even know Betty could do some of these things.
That's wonderful.
So this is the first one I've had like that, because most of them were just, I'm here just in case, and I'll look at my phone or I'll watch television. This lady is really, really something. She's just, I told her today, I said, you're the angel of the house now.
Oh, I know that made her day.
Yeah, I mean, she has helped me understand, and that's why I caught up with some of the things you were saying, because this is happening now. Some of these things were really hitting me as, wow, maybe we can do these things. So for that, I appreciate. I just hate I couldn't make the first half, and I definitely will look at it. Will that just be a recording to look at on your homepage, like, and scroll down? Is that where it's going to be, or are you going to send it?
I'll send it to you. Yes.
Okay, I appreciate that so
I'll
much.
send it to everyone that that registered for the webinar, since you did not receive a reminder, which again I apologize for. So I'll make sure you get that. Yes, and
Okay.
I love that you have someone that's working out really well. It's always hard to find a good fit. So congratulations there. And so maybe you and this new aide can kind of share ideas. So if you have an idea that's something you've tried from this webinar that works, you can share that, and vice versa. Ask her, what's your magic? Share some of your tips with me so that you can continue that.
I'm tomorrow or whenever I get this recording, I'm going to give her some time to come back and sit in this chair and listen to you.
I love it.
Because
I love it.
I don't know really what she knows yet, but it doesn't, I've learned anyway from people like you coming in and helping us that you may think you know, but there is so many different things, and experience brings out so much. And you did a beautiful job at saying this, and then this happened, so that it cements it in your mind. So it's not like going through it real fast. Just reading a book, I'm going to play with that a little bit. I think I'll probably have to do what you did, is find a level that seems to work. And then try to find something she really likes. The music thing, she loves music. And
Bill, something that just popped into my mind, you have grandkids, I know. They might be really good to read to Miss Betty.
Probably.
Might be a way for them to connect. I know they're not always sure what to do with someone with dementia either. So that could be a meaningful activity for them.
And I think you made a really good point earlier about, you said you have to keep asking yourself, like, how much more do I have to simplify this? And I do think it does vary, right, in the moment, depending on the kind of day the person's having. But it's also like a very important point. Thank you for bringing it up. We're all, even like classroom teachers, as speech pathologists, we try to educate classroom teachers, like, watch the way you say things, watch if you're using an expression or a phrase. And, one time I asked a kid, I said, you're going to talk on top of me, which meant the same time as me. And he tried to get on top of me because he was 3. So like, we always have to think about, how can I simplify it, or what language am I using that doesn't make sense to them? It is like a constant process. I'm so happy you're thinking about it.
I just appreciate so much what Lisa does in bringing people in that are so good, and it really helps us. I can remember about 6 years ago, I didn't know anything and I was going nuts. Now I've absorbed so much. And you know what's really neat, Keena? At my age, I am absorbing this stuff.
Yes, you are. You're like a sponge, Bill. You really are.
And it's, that's not me. My memory's not that good, but for some reason, I guess the level of interest really helps you remember things. I wouldn't have said
for your
that
dedication
before.
to Miss Betty.
Yeah. I've been wondering why I've been able to remember so much. And then I reflected back when I was a teenager, and if I happen to meet a girl, and I could never remember telephone numbers, but I remembered her verbal giving me the telephone numbers. And I reflected back there just a little bit ago thinking, that may be why, I have such an interest. That may be why I'm absorbing this stuff.
Could be. And Bill, another thing that you do, and I promise we'll end it after this, you have a really great way of sharing what you learn with other people. And that's a great way to retain information. So you learn this stuff and then you want to go share it with someone else. And that's huge. That's huge. That
Well,
helps.
I hadn't thought about that, but you're right. If you really want to learn a subject, teach it.
Teach it.
That's right.
And
Absolutely.
right.
I hadn't even thought about that, but you're right. I love to share it. And, that really, because I can remember how bad it was before I didn't know, before. That was horrible. So, yeah. Good. That's helped me a lot too. Maybe I'm not doing so bad at this age.
Oh, you're doing fantastic.
Great.
Are you kidding me? And you're all doing fantastic. I mean,
Yeah.
The amount of stress that you guys are always under, you still manage to do a beautiful job of caring for your loved ones. You inspire us every day. You're why we're here. If we didn't have faith in your ability, we would not be here. But you're all amazing. And Kathy, you are amazing. Thank you so much, not only in your own caregiving journey, but for sharing so much of your wisdom and time and experience. We really appreciate it. Thank you so much for being here today.
Thank you for having me.
Yeah.
Absolutely. Well, as I promised, you will get this video, guys. I'm going to work on it now and try to get it a little quicker than usual. And if you have any questions for Kathy or for me afterwards, just let us know and we'll do what we can to get them answered for you, okay?
Very good.
Thank you all so much. Thank you.